name's Christy. I'm pretty sure all of us have been to a hospital for one reason or another, but there's a group of people that make it their goal to stay in the hospital. They even make up symptoms and fake things in order to make them stay in the hospital longer. These people have what is called factitious disorders. You may know it better as Munchausen syndrome. British physician Richard Asher published the very first account of Munchausen syndrome in 1951. He named it after 18th century German Baron Karl Friedrich von Munchausen, who wowed his friends with wonderful tales of daring adventures he went on that never actually happened. Now, the symptoms for this disorder are completely voluntary and under the patient's control. There's no obvious gain or reason to any of these symptoms, which would be called malingering. And the only benefit available for these patients is assuming the sick role and receiving increased attention. Now, these patients have dramatic but inconsistent medical history, and they have an extensive knowledge of hospitals or medical terminology, as well as textbook descriptions of illnesses. The presence of symptoms only occurs when they are alone and not being observed by a doctor, and their symptoms might become more severe once treatment begins in order to prolong the treatment. The theoretical causes for this disorder suggest a history of abuse or neglect as a child, a history of frequent illness or that was regarding hospitalization as a child, and there's a possible link with personality disorders. Now, statistics for Munchausen syndrome or factitious disorders, this is a very rare disorder, and it's hard to pin down an actual statistic or prevalence rate because the dishonesty is so rampant. When a patient is close to being caught, they'll just go to a different hospital and start the cycle all over again. And most Munchausen patients are male, about 2 to 1 over females, and they range anywhere from children to elderly, but it's mainly middle-aged. And it is extremely tough to diagnose. Doctors must exhaust every other possible diagnosis before considering factitious disorder, and then they would regard a psych consult. Now, the most famous case of Munchausen syndrome is Wendy Scott. She's a British woman who's admitted to more than 600 hospitals in 12 years. She underwent 42 surgeries that were all unnecessary. It was believed that she developed this from the attention of a kind nurse when she was a child because she had never gotten this type of attention before, which also goes back to the theory of childhood neglect and abuse. Now, she got the nickname as the hospital hobo because she didn't have a home. She would just go from hospital to hospital, and that was her home. When she finally recovered and gained treatment from this disorder, she actually developed a real intestinal cancer, and no one would take her seriously, like the boy who cried wolf. She found out it was inoperable, and she died 6 months later. Now, the treatment is only available if the patient is willing to admit that they have a psychological problem instead of a physical problem. And most of these patients, they don't want the treatment. They would just rather start the cycle somewhere else and start the sick roll all over again. Cognitive behavioral therapy is one of the only things that work. Medication does not work for this disorder, and you must be carefully monitored with the prescriptions in order to decrease the chance of an overdose. Now, for the outlook for Munchausen syndrome, it's not very good. There's a high risk of suicide and substance abuse, and it's more realistic to work towards managing the disorder rather than curing it. Now, I think most of us have heard of Munchausen syndrome by proxy. It is actually referred to as factitious disorder imposed upon another, but the more common name, Munchausen syndrome by proxy, has been featured in TV shows like Grey's Anatomy and House, and has caught the eye of the media by how gruesome and cruel it is to the children. Munchausen syndrome by proxy is an atypical form of child abuse, and it's almost always a mother making her child sick, evidently for attention, pity, or sympathy from others. The mother typically establishes a positive relationship with nurses and doctors, making them think that she would never do anything to hurt her child. The mother can do extreme things to fake the symptoms in her children, such as adding blood to the child's urine or stool, withholding food so the child looks like they can't gain weight, heating up thermometers so it looks like the child has a fever, giving the child drugs to make the child throw up or have diarrhea, infecting the IV line to make the child look sick. Now you can kind of tell if this is happening if there's a very strong bond between the mother and the child, almost too strong that the mother wouldn't want to be separated from her child for any reason. The child would have strange symptoms that don't fit any disease, and the symptoms don't match the test results. And in some cases, the blood from the child doesn't match the blood that was given for tests. Drugs or chemicals can be found in the child's urine. The child's symptoms are reported by the mother, but never seen by doctors. The most famous case that has been all over the news and featured in many TV shows is of Mary Beth Tinney. It's very gruesome. She had 9 children. 1 was adopted, the rest were by birth. Her 3rd child died 8 days after birth from medical complications. And it's after that she pretty much became addicted to the sympathy that she got after her child's death. Shortly after that, within 2 months, her second-born child died of a medical complication. Then 2 months after that, her firstborn child died from a random medical mystery. She then began getting pregnant, having a child. 2 months later, 3 months later, the child would die. That happened for all 9 of her children. The oldest they ever got was 5 years old. The median age was about 3. Her last child was Tammy Lynn, and shortly after Tammy Lynn was born, Mary Beth, instead of faking a medical complication, smothered Tammy Lynn, saying that she wanted to spare her from dying like all the others. Mary Beth was arrested right after Tammy Lynn's death, and she's currently serving 20 to life in prison. Now, finding this disorder is almost a little bit easier than finding factitious disorder or Munchausen syndrome, because you can perform a separation test, taking the mother away from the child for a couple weeks to see if the child gets better. You can also use surveillance systems. A new study found in 41 children presenting with difficult to diagnose problems, 23 of the cases the parents were responsible for the condition, and this diagnosis was made possible by surveillance systems in the hospital room. So implementing one of those tests can help you find it before it gets out of hand. Now, treating this disorder, you need to protect the child, withholding care from the parent, giving them into protective custodies. You have to call the authorities since it is child abuse, and the child may require medical care to treat the complications from the injuries, such as infections, medications, unneeded surgeries or tests. And they might also need psychiatric care to help with the depression and the anxiety, and even in some cases PTSD from this happening. And treatment for the parent goes back to normal treatment for factitious disorders with cognitive behavioral therapy. Thank you for watching.